Health Minister and Chairman of the Ministerial Committee on Ageing says the government will look at all kinds of possible support to encourage families to care for their elderly family members at home. For one, more households can look forward to receiving help right at their doorstep. Vimita Mohandas with more.
The government will be beefing up healthcare facilities and support for the elderly as Singapore braces itself for a silver tsunami. It's estimated that by 2030, there will be 117,000 seniors who are semi-ambulant or non-ambulant, more than 2.5 times that of today. Now, even as plans are underway to ramp up the number of nursing home beds, what the government wants to do is to tilt its subsidies to make it cheaper for families to look after their elderly sick at home instead of sending them to nursing homes. Speaking to Channel News Asia after a budget forum, the health minister said financial incentives alone are not enough to shift the mindset of Singaporeans. And the government has to further reach out to residents to encourage them to adopt home care. At the same time, more daycare facilities will be built.
This will include building daycare facilities in the vicinity so that these elderly sick can be cared for in the day facilities. They don't have to travel all the way to hospitals or to treatment centres. These facilities will be just downstairs in the void decks or in nearby facilities. So this is an important part of our strategy to facilitate home care.
The newly announced $120 foreign domestic worker grant will also help support home care. But to qualify for the grant, employers must send their domestic helpers for training on how to care for the elderly sick.
We believe that the demand will continue to increase because of the aging population and the growing need of caregivers who want to care for their loved one at home.
There are about 20 organizations offering training in intermediate and long-term care for caregivers.